Hi, my name is Kala Kuzaraj.
Hi, my name is Anjana Iyer.
Hi, my name is Sonali Kandapalli. And we are Team D from St. Francis High School in Mountain View, California. For our project, we chose to improve upon existing wireless insulin pumps to create an insulin delivery method that is more effective for pediatric diabetes patients.
The most common treatment of pediatric diabetes is through continuous subcutaneous insulin infusion, or CSII, using what is commonly known as an insulin pump. This method of insulin administration is able to simulate normal insulin secretion patterns through adjustable basal delivery, along with boluses, allowing for flexible and precise insulin delivery. This approach is far easier than the original method, which involved multiple daily injections, or MDI. In order to address this clinical issue, our team has created a novel insulin pump called Smart Insulin. This pump will replace a traditional catheter used with insulin pumps with a painless microneedle system that will deliver insulin subcutaneously. A significant novel feature of Smart Insulin is the accompanying mobile application that would allow parents to remotely control both the basal rate and bolus dosages, as well as keep a log of each delivery of insulin. One of the most significant drawbacks of current CSII treatments is the psychological impact that the use of insulin pumps can have on diabetic children and their families. CSII users must constantly be accessible to caregivers who are often hired, as parents are unable to watch over their children all day, particularly parents that work or travel a lot that cannot provide their children with 24/7 care. In school-aged children, school personnel specially trained and constantly supervise diabetic children in order to ensure the proper function of the insulin pump, which can strain teacher-student relationships and increase the stress on diabetic children. Thus, quality of life rarely increases despite the use of insulin pumps, particularly for families with diabetic infants or toddlers. Additionally, the catheter often used with CSII treatments can be painful and result in trauma for young children, who may develop negative associations with the catheter or needles, hampering future treatment.
The concepts we studied during our research include diabetes, insulin, the functioning of insulin pumps, use of microneedles, and cellular development kits to create a cloud-based data delivery system. Diabetes is a disorder of metabolism. It is a disease that occurs due to a malfunctioning in the production of insulin, which is a molecule that helps cells absorb glucose produced by the pancreas. Without insulin, cells cannot receive glucose. In type 1 diabetes, often called juvenile diabetes, patients are unable to produce their own insulin. This is an autoimmune disease in which the immune system attacks the beta cells of the pancreas. In type 2 diabetes, the body is not responsive to the insulin produced. The glucose in the body builds up as it is not absorbed by the cells, and the body is unable to use it as fuel. There are several types of insulin. There is short-acting or regular insulin, which is basal insulin, because it remains in the body even after food is absorbed. Fast-acting insulin is usually taken right after a meal and works within an hour. Intermediate-acting insulin affects the absorption rate of subcutaneously delivered insulin and has a rapid onset. If too much or too little insulin is delivered, hyperglycemia or hypoglycemia may occur, which can have serious consequences such as neurocognitive damage. Traditional insulin pumps using CSII deliver insulin through a catheter, a long, narrow, flexible tube that is inserted just underneath the surface of the skin. The pump has an insulin reservoir within which it contains short-acting insulin, which begins to have an effect within 30 minutes of delivery. The user must program the pump to release a bolus, which is an extra amount of insulin released to cover the expected rise in blood glucose following a meal, which is based on the amount of carbohydrates in the meal. Basal insulin is delivered continuously over 24 hours to regulate blood glucose between meals. This rate can be programmed depending on the time of day, for example, more during the day and less during the night, and then the pump is often clipped onto a belt or worn otherwise near the skin. Microneedles are an integral part of Smart Insulin. Microneedles are microscopic storage units that also contain glucose-sensing enzymes in order to both monitor blood glucose and deliver insulin. Hollow microneedles can be used to deliver multiple doses of liquid insulin intradermally, similar to the subcutaneous insulin delivery model. Microneedles are painless as they do not penetrate the skin deeply enough to touch any nociceptors, which signal pain. Thus, they are far less intimidating and may increase patient compliance. The insulin reservoirs from a traditional insulin pump can be used to refill the hollow microneedles, replacing the large, painful catheter that is usually used. The link between the pump and the application allows for instant uploading and downloading of information. Smart Insulin is built with a cellular development kit, which allows the device to work over a global data connection. When the smart pump uploads its data to the cloud, you can monitor and control it from anywhere in the world through a secure connection.